One of the most common questions I get from people when I meet in the community is, what's going to happen on my first visit? What should I expect when I go to a chiropractor? So I thought in today's video I would briefly address those things. Now, what I can really speak for is how I run my practice and the things that I do, but I do have a huge network of amazing chiropractors internationally that I work with, and I can tell you that you're going to get great results if you have an exam that includes a lot of these things. So step one is you're going to have a thorough consultation and diving into your health history. What are the challenges you've had in your health in the past, and where are things now, and what's the best way that we can help you. It might seem that some of the questions your chiropractor asks you in your health intake form and in the paperwork don't really seem related to what's going on with your health at this moment, but sometimes information will give us other little pieces of information that can help us really get to know what's going on with your health in a much bigger way, that can help us solve some of the puzzles of your challenges in a more in a deeper way. And so I always say, the more I know about you, the more I can help you. So you should have a thorough consultation and a chance to explain what's going on. You should definitely feel heard, feel that your concerns are validated. And that all starts in your first conversation. Examination-wise, what you should be looking to have done is, some range of motion testing. So that should include, your full spine, your neck, your mid-back, your low back, any other joints that might be challenging for you. So it's not uncommon for chiropractors to also check people's wrists and shoulders and ankles and knees. So, range of motion testing for the spine and any other associated joints. You want to make sure that you've had some neurological testing done. As chiropractors, we're really concerned about your joint mobility and your spine mobility, but also because how does that affect your nervous system and your brain? So oftentimes, if there are misalignments in the spine, if there are imbalances in your muscles and there's inflammation, you're also going to have some pressure or some irritation to the nervous system and the cardiovascular system as well. So you want to make sure that your examination includes some tests to rule out any problems that may give us some other concerns, that we might want to do some further testing, whether it's with x-rays or having a physician help us with ordering an MRI or a CAT scan or something. So neurological testing is really important as well. You want to make sure that your chiropractor also does some kind of posture assessment. We joke, posture is the window to your spine. When I look at someone's posture, I can very quickly tell you what's going on with their spine. So your posture should be assessed, looking at you from all sides, your front, back, side. In my office here, obviously, I also do a lot of joint palpation. You want to feel how not only the areas of the spine are moving, but how the individual joints are moving. So there's a huge component of segmental joint palpation and using my hands to figure out what's going on. Some chiropractors will use other types of muscle testing, orthopedic tests, but all of these things come in to give us the same conclusion: is how healthy is your spine? What can we do to maximize the mobility and function of your spine so that you can regain the health and the mobility that you deserve? So those are the key components in your initial assessment. You should have, a thorough consultation, and then you should have a thorough examination. For me, once you've had those two things done, my next step is to take some time and look at everything and review things, and then give myself a chance to make recommendations for you. And that will be another visit where you will come in and you and I will look at everything together. If I've sent you to have some x-rays done, we'll look at them together as well. And we'll make a game plan to figure out what's going to be best for you based on your goals and based on your current level of health and your time and your benefits and your affordability and finances and all those other things that need to be considered. So, those are the things I recommend everyone when you're looking for a chiropractor. You want to make sure that, you feel heard, you feel cared for, you had a thorough examination done, a thorough health history, and that you were given adequate time to ask your questions and then, make a plan with a doctor that's helping you to regain your health. Hope this helps you. Find a chiropractor who works with you towards your goals. And if you certainly, depending on where you live, if you need a referral of someone who's closer to you, we are always happy to provide that. We know lots of doctors across the country, internationally, that are happy to help you not only feel better and get out of pain and reduce inflammation, but just expand your body's ability to perform the way it was designed to.